Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. We have two special guests today. We have Travis White, he's SVP of Market Strategy and Adoption at Kno2, and Therasa Bell, she's President and CTO at Kno2. Welcome.
Welcome. Thank you, John.
Yeah, thanks, John.
Yeah, excited for today's discussion. You know, we had you on a previous episode of our podcast and an interview, and we talked kind of about the current state of healthcare and the need for better communication, across healthcare. But I think a lot of organizations are looking at it more from a digital transformation standpoint. Can you kind of, maybe you can start off, Therasa, help everyone understand why Kno2 is hearing this industry talk about digital transformation versus just, interoperability?
Yeah, absolutely. I'd mentioned in the last podcast, but I had a week in June of this last year where I had received 3 phone calls from different, a CEO, a chief strategy officer, a CTO, that all ran different types of healthcare organizations that sat across the ecosystem. And all of them had desperation in their voice when they called me and said, Therasa, we're at this critical point where all the market forces that we're feeling right now, everything from staffing challenges to reimbursements being cut, changing care models, they're having to meet the needs of the health systems and make sure that they can go into these strategic relationships. So they'd called me with this desperation of how do they get to their journey, this digital transformation journey they needed to go through, when at the heart of it was data needed to start flowing into their organization, patient information needed to start flowing in and out, and they had no idea how to do it and how to bring it back in. So after the 3rd call, I was smart enough to respond to that. It only took 3. I immediately called Travis, actually, and said, Travis, we need to help our consumers of our API and the consumers of the technology and help them actually apply it in their organization. And that is where we brought them an offering and a tech-enabled service. So we looked at it and said, we're not a professional services organization, but we certainly want to help our customers and the end users apply this technology. And that's where we came up with an offering, a tech-enabled service, and say, we're going to see this come to reality in the market.
Awesome. Well, I love practical innovation. That's a feature here at Healthcare IT Today. It sounds like that's what you did, right? Not just give them the data, but how do we make it useful? And that new product's called CAREplan. Travis, maybe you want to give us an overview of, what is in CAREplan, what are you offering, and more about the motivation behind it.
Yeah, absolutely, John. So I think at the heart of the motivation, it's just being helpful. We want to serve. To Theresa's point, when we started seeing the pattern emerge and the individuals reach out to the organization seeking help and that guidance, CAREplan is really just an acronym born out of what we feel plays out in the clinical world. No different than a treating physician will provide a care plan to an individual with a chronic condition. We know that there are chronic conditions in the digital world that have persisted for far too long. And the CAREplan represents connect, analyze, reform, and evolve. Each of those very critical stages, and they are in order for a reason, but each step along the way in an effort to level up their organization's ability to interact digitally, reform workflows, taking into account what's playing out inside of the 4 walls of their organization and the community they're interacting with. And when you take the deliberate steps to create an interoperable identity for an individual, you connect, and you really allow them to start playing at that level, whereas before they may not have been able to. And then in the analysis phase, where we start to take in and consume the data that they have, we pass that through all of the 10 years of learnings and analytics that we have to then compare that and drive deliberate outcomes. So taking into account what are their stated outcomes for reform and evolve, and then letting the analysis drive evidence-based innovation so that you're solving the right problem. At the end of the day, the care team in healthcare has often kind of passed through a very logical bias that the care team is in the context of the human providers, the human care providers within that care team. But far too long, the technology portion of that care team is not really considered a member. And the net result is that the technology does not empower or enable the care providers to do what they need to do. So by really kind of shifting that bias and disrupting that bias to say, look, the technology always needs to be performant inside of the care team continuum. And by doing so, and by leveling up that organization's technology to actually empower the providers to do their job better, the technology starts to do more so that the people can do more. Because we've kind of taken historically this stance that connectivity and interoperability inside of a workflow aims for the floor and maybe gets there, but the technology doesn't really empower any kind of real outcome. And so that's why so often the net result is that they don't really feel there's that much power in interoperability, or they think it's just an 8-syllable word and they don't know much beyond that. Yeah. But by taking and holding the standard to say, look, we're actually going to level up your technology through this CAREplan initiative and through this offering, we can actually allow them to not just focus on getting the clinical code right from a technology standpoint, because just because we get the code right doesn't mean we get the care right.
Yeah. That's a good point. Yeah. And I love the idea that we have a chronic digital problem.
We do.
And it sounds like CAREplan is an interesting treatment for that chronic digital problem.
I think one of the important things about CAREplan that I just loved about the idea is that you look at the CAREplan with a patient, and they always factor in the goals of the patient. Yeah. And they're very personal, and it's very individual with a CAREplan. And you take a common set of technology, right, and you apply it individually to the patient, and that's what we're doing with these providers, because they've all come with different parts of their journey. It's a very personal journey, getting the patient engaged faster. So how do I get my patients engaged faster? Well, it starts with knowing about my patient to be able to even digitally interact with them, or that may be one of their goals, or they want to start expanding into virtual care services. Well, I can't get to virtual care unless I have data to feed my virtual care system, and how do I enable that? And then I have to respond back to the continuum and the rest of the care providers that are caring for that patient. So there's just so many facets to it. Again, the heart of it is the data and their personal goals of what they want to do with the data, which is what the CAREplan service does. So I love the model. I think it fits on so many different facets.
Yeah, and when you talk about that, how do you really measure success with a client? Because they all have different needs and different goals. Like, how do you measure success with the client? And talk maybe about some of the practical things they can expect if they work with CAREplan.
Yeah, I'll start it out, and I certainly want Travis, and it's Travis's team that's running the CAREplan. But the first thing is get to know what their goals are. But we also get an assessment of just their core health, if you will, their interoperability health. So we look at how connected are they to the ecosystem today, how meaningful is the connection, and then we start to build up their health. And so there's some, kind of rinse and repeat moves that we make with every organization, but then we ask them, what do you want to achieve? What are you looking to achieve? And we set them on that path. And one of the very cool things about the CAREplan is that we also take risk with it. So similar to some of the risk-based contracts that we see, we're very comfortable and we're very confident in the technology and what No2 does. That we're willing to take the risk with the provider and say, you tell us your goals. We're going to both be at risk for this to get it done and see it happen.
Nice.
Yeah, that's great points, Therasa, and I would echo those sentiments entirely. I think the key piece of these interactions, and when we start out the CAREplan journey with these provider orgs, it really is about getting those specific targeted outcomes, and not just serving up a solution and saying it's a solution. Because we all know that persists, and unfortunate that most users deal with struggle moments in their workflows. They deal with friction points in those workflows, and the user abrasion may not translate immediately for that organization to be able to articulate a request and say, I need you to do this, this, and this, and in a very simple way. They might not know how to ask, but they do know the outcome thereafter. And so it's really a conversation. We have the conversations with these organizations in those early stages to just really map out what it is that they're trying to accomplish. And when we start to get a clear lay of the land, we can clearly articulate those milestones through targeted objectives. And then to Theresa's point, we tie the whole thing to it. And instead of a simple fee-for-service, pro-service thing, we intentionally model it after a fee-for-value. That if we can't get you to the outcomes, then those economic moments don't happen. And so it's a powerful disruptive model, and I think it's one that's resonating with the organizations.
Yeah.
One of the things that folks always look at in the CAREplan is that evolve step. And people say, well, what does that mean? And the answer is, we don't know yet. It could mean anything. And that's the...
It's going to evolve.
That's exactly right. People say, I can't wait till healthcare gets to interoperability, as if it's a milestone that we achieve. It's not. right? It's a progression, and who knows what the future holds is once the data flows. I mean, just look at where we've gone with like social media, and now it personally knows me. It curates information on my phone because of all the data available. Who knows where it takes us? You know, Evolve is really the kind of the personal part of the journey where these providers, once they're set free, they can really do anything. So it's exciting to watch it, and it's exciting to go through these initial steps with these providers and see them be able to engage with the strategic partners in their community that have a lot more technology at their disposal. So they go into these joint ventures, they go into strategic partnerships, and they're offering, outsourced therapy services as an example. Now I can, check the box when the RFP is sent to me saying, yeah, I can share patients' information dynamically at scale. I can meet every expectation that you have, Mr. Health System, and be able to do it. So it's really fun. It's a lot of fun.
Yeah. Well, it feels like that work is never going to be done. I kind of hate the word platform because it's been abused so much, but it's a platform that can solve a lot of problems, many of which we maybe don't even understand until we have the data there. Is that kind of how you'd see it, Travis?
I'd take it a step further too, John. I think that, at the end of the day, it's not that we're serving up a piece of single, one-trick pony piece of technology for them and forcing them to consume it, rather than taking the entire ecosystem into account and really looking at all of the technology doesn't mean all the technology that we sell them. It means all of their technology, the whole world that surrounds them, and what enables the actual outcome. And then intelligently, interweaving all of those systems so that it orchestrates all of those specific moments in the workflow to actually get them the desired outcome that they're after. So yes, is there technology that's at the heart of this? 100%. But is it the only thing? No. Some of it is both workflow and technology. Some of it is change management, education. Some of their existing systems that these organizations have actually already invested hundreds of thousands of dollars, millions of dollars into. Now more than ever, they need to get the absolute most out of that technology that they ever have before. And so CarePlan is all about just leveling up the use and consumption of their digital footprint so that they can actually drive innovation within their four walls and in the communities that they serve.
Yeah. Are there some types of organizations that you think are best suited for CarePlan? Is it large organizations, small organizations, and are there maybe some early use cases where you're like, oh, this seems to maybe resonate? Maybe Travis?
Yeah, absolutely. So I would say, and I'll let Therasa opine here as well, but we have seen kind of it run the gamut. There's an appeal across the entire spectrum. So an independent organization that is just really forward thinking, or maybe they're not as patient as just enduring the sufferance of constant poor workflows, and they want to drive an innovation in their environment, and they're really agile, so they can do that, but they don't know how. So they come to us and we can help them with CarePlan. Or large physician owner groups or joint ventures that have much more at stake and much more scale to consider, a whole lot more architecture in play. But at the end of the day, the approach is consistent in that the way we engage, whether it's a small or a larger organization, the model is proving that it works. So we are seeing the attraction from large health systems, physician owner groups, all the way down to practitioners.
Yeah. Therasa, what would you add?
Yeah, not much to add there. I mean, it's suited for everyone. It scales to everyone. So from a pricing perspective, making sure, if I'm a small provider, again, speaking to our common example we use internally, a PT in the strip mall that works part-time, they can afford it because it scales with that all the way up to, the largest of health systems that Travis and his team are engaged with to help them, connect with the rest of their community at scale. So it fits all of them, and we'd welcome all of them to come in.
Well, how is it changing from an interoperability, and not necessarily changing, but evolving from just interoperability to digital transformation? How is that a mindset change for you and your customers?
It absolutely. I mean, you can look at the long-standing theme at HIMSS, right, and see that interoperability. I always say when it moves from being a noun to a verb, then we know that we're getting there. We're making progress, and it's starting to do that. So it's becoming. It's going from something that I I owned as part of my EHR, I checked the box on,
right,
to something I'm applying. I'm applying at an enterprise level, and I'm seeing outcomes. That is the goal. And getting, it's the worst marketing campaign ever has been interoperability. So I would say it's the worst long-standing marketing campaign. But seeing it change to discussions around meaningful connectivity, is really where we're seeing meaningful connectivity and communication is really where we're seeing the application of it.
Awesome. Well, Therasa, Travis, I appreciate you taking time to share this interesting new product that really is, I think, a great evolution forward, right? Because it's great to share data, but if we don't do anything with it, who cares, right? So thanks so much for sharing, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks.
Thank you.
Thank you.